Okay, I think we'll get started. We'll probably have a few others join us in progress. First of all, thank you all for joining today. We are recording the session, so hopefully you can hear it again or share it with colleagues if you wish, as soon as we are able to get it posted. So today I'm going to ask you to bear with me as I take you along a circuitous path. I'm going to talk about the development of the original APPR and to where we are about to ask you to submit to us for your next APPR. We're going to revisit the original purpose and intent of the APPR, what the purpose was for the states, as well as what the purpose was for the feds, for us guys. I'm going to share with you what we did with the data and the other content that was submitted. And based on what we learned, I'm going to share with you the path we traveled, the initial proposed modifications to the APPR tool that we were going to propose to you. And then I'm going to take a sharp U-turn and I'm going to share with you what has happened to cause us to go down a significantly different path. I'll share a totally different approach to completing this year's APPR and what we hope to gain from this approach. And then some of what I'm about to share may be shocking or cause frustration or just be surprising. But it's our hope that by the end of the APPR, by the end of this APPR webinar, you'll receive this information as a pleasant gift. So a few other items before I get into the content. First of all, when I'm done talking, there's going to be a period of time for you to comment, to ask questions, to share honestly what you think about what I've shared with you, to make recommendations. So we'll talk about what the next steps are going to be. And there is going to be a period of time, depending on how much conversation we have, we are planning to have breakout rooms so that you will have a chance to go into these breakout rooms to discuss some of the items that we're going to discuss in a few minutes, some of the questions we're going to pose that we want you to talk about. And then if time allows, we'll come back, have a kind of brief, quick report back, and we'll talk about next steps. So that's the plan for today. And what I want to do is just start with basically talking about the original intent. Now, I think most of you have heard this already, so I won't spend a lot of time on it. But when we created the APPR was intended to be a natural follow-up to the comprehensive needs assessment you completed, the strategic plan you developed, the program performance evaluation plan that was going to continue to inform and improve your strategic plan. And then the APPR was supposed to be both, for your perspective, helping you begin to collect the kinds of data that would be useful to you to better inform the PPEP and the strategic plan and the work that you were doing in your state. So we hope that it would help you create baseline data, help you look at what data you're already collecting, what are you not collecting, determine what needs to be collected that goes beyond the APPR. We wanted the APPR to be a trigger to help you think about the data that needs to be collected. On our end, on the federal level, we realized that we didn't really have a good way to begin to collect data from you. And oftentimes the data we collected was different from state to state. So when we were constantly getting questions from congressional members or leadership, what can you tell us about one item or another? We could talk about individual states, but we really couldn't talk about something across all states. And so we tried basically a trial and error approach to creating a tool to determine if the data we were asking you to provide to us would put us in a better place to be able to present reports or information to leadership and congressional legislative members about what states were learning, what states were doing, and put us in a better place to say, not only do we have the stories, but we now have some qualitative data that backs up those stories. So that's what we hoped. And as I mentioned to you about the APPR before, the idea here was that this would be something that would be modified as we went through each year. So in the first year, it was really a test case for the most part. We would make adjustments, we would tweak for the second year, possibly make adjustments, tweak for the third year, so that by the time we got to the third year, it was our hope that all of you would be able to collect the data that we were asking you to collect And we would have that across all the states so that we could tell a story, a data story at the end of the third year. We knew that at the end of year one, some of these data questions would prove to be either not worded correctly or need better definitions or whatever the case may be. And so we were hoping to then analyze that. So what we did was we basically took your data, took your content. We asked those of you who wish to be part of a work group, a grantee work group, to come together and work with our TA provider. And you met on a regular basis for about 6-7 months to kind of talk about the challenges of the APPR, what you found difficult to understand, what was confusing, what was hard to collect, what would have been better if it had been said a different way. And you came up with very specific recommendations of what would make the APPR more useful or more effective. At the same time, the TA providers did their own analysis across your APPR tools. The federal project officers did similar analysis and looked at what was helpful, what was clear. And we saw that some of the questions we asked either were not well asked, we asked the wrong question for the kind of data we wanted to collect, or we did not provide a clear enough definition or clarification of what we wanted in a response. And because of those things, we got back some very iffy data in some cases. We got back, many of you interpreted the same question in different ways, or you spent hours trying to sit together and figure out, what do they mean by a registered provider? What do they mean by some other term we were using, right? What are they looking for here? How does the mixed delivery system participants differ from the comprehensive early care system members? They ask us to list them, but didn't we already list them over here? And some of you listed twice. Some of you included vendors. Some of you did not. Some of you included universities. Some of you did not. And so in some questions, we had really good continuity in the way states responded. In other questions, we really had very different information. And so we basically did not share any of this data with anybody else. It was basically internal. It was for us to analyze and use, determine if it was really helpful to you, determine if we could use it in our next report to Congress or in our report to leadership. And at the end of the day, we decided to just use it as a test case. Based on that, we decided we took your recommendations. We actually, the FPOs and TA providers sat down, Judy Wilgren and Becky Merrick and others, along with some of the TA staff, sat down, and we actually created what we thought was going to be the revised APPR. It's not, but I want to share with you what we thought we were giving you and why one, we went that way, but also why we then changed. So the changes we made, first of all, we significantly reduced the APPR Excel spreadsheet. We basically eliminated questions that didn't make sense or that weren't clear or that we didn't think we could clarify sufficiently, or we said, you know what, we got the answer, but we're not going to do anything with that data. It's not really data we need. So why ask the states for it? Maybe the states can use it. So remember, again, the purpose of the APPR for you is to help you collect data that's going to be useful to you in the planning and the work that you're doing in your state. Hopefully, some of those APPR questions do that, but probably some of them do not. And so what we tried to do is take your recommendations, eliminate questions. We more than half the length of the Excel spreadsheet. We took out any item that was a narrative question, and we put it into a narrative template. And we said, okay, this year, what we're going to ask for is a much reduced Excel spreadsheet, a narrative template with 23 narrative questions, the same questions that were in the Excel spreadsheet, but we reduced the number of sections. So now instead of 9 sections, there were only 6 sections, less questions in each session, and the narrative questions came out into the template. We also created an APPR guide, which would give you better definitions. We give you clarification. It would say, here's the question we asked, here's what we're looking for. And we had the guide created. And that's when the curveball came. That's when the twist came. So as many of you know, here's where we take the sharp turn. As many of you know, we have something out there pending called the American Families Plan. And the American Families Plan has, besides a lot of money for childcare, it also has a universal pre-K program that is not yet in existence. And the child care program that they're proposing is very different from the child care that exists now. And I began, not just me, but we began to get questions as to, well, what is the data we're going to ask states to collect in this new UPK program, in this child care, newly formed child care program? And my initial response was, I don't know. Haven't figured that out yet. Haven't seen the legislation. Don't know what we're going to be mandated to collect. I was treating and I said, look, that's about services. This is about systems. We have a tool where we're collecting data. We think we're about to modify the tool. And the question was posed back, well, don't you think that you should, before you change the questions, the data you're changing to, or planning to collect, don't you think you should wait until you actually have figured out the data you may want to collect from these other two new programs, assuming that this legislation passes, which everybody's expecting at some point in time in some shape or form? And so we kind of went back and forth with, well, okay, does it make sense? Are we going to be asking for data that we then doesn't really align? Are they ever going to align? Not really sure. But it caused enough questions for us that we then kind of said, okay, originally we talked about having this, is there another way to get at what you are doing in your state? The data was supposed to help tell a story. We still need data to tell the story, but some of the feedback that you gave us, besides telling us that you were confused by some of the terms used or some of the definitions and needed further clarification, some of you said, well, look, we want to tell our story, but the data you're asking for doesn't let us tell the story the way we want to tell it. It actually impedes our ability to tell our story. Now, that's not everybody, but a lot of feedback came that way that said, if you asked us to tell the story, we would tell it differently than the way you're asking it in terms of the APPR tool. So thinking about those pieces of feedback, we then said, okay, if we don't know when the legislation is going to pass for UPK or child care, but what if we approach the second year's APPR, or for those 5 grantees who are going to be doing the APPR for the first time, you won't have to worry about shifting. But what if we propose to do it a little bit differently? What if we propose to allow you to tell your story in the way that makes sense to you by giving you core narrative questions that we can use in next year's report to Congress, and at the same time expects you to use your data to answer each question in the way you deem most appropriate with the way you define terms. So if you don't use a term, like if we say registered provider and you say, well, we don't use registered providers, then you don't have to talk about registered providers. On the other hand, if you do have registered providers, you can define what you mean by that, and you don't have to spend hours trying to figure out what we intended when we asked you to use that term. So what we've come up with now is we've taken the 23 narrative questions that were pulled out of the Excel spreadsheet and put into our narrative template, and we said 23 is too many questions to answer anyhow. Let's see if we can combine them or merge them in such a way that we're still getting the same basic information that's going to lead to the kinds of questions that Congress is interested in, and yet allows you to tell a story so that you can use data in answering each of these questions. So we went from 23 questions to 8 questions. We're now proposing to ask you 8 fairly comprehensive questions. So in all honesty, there are 8 questions, but some of those questions are multifaceted, right? But they're at least aligned, and they focus on the key things that you're doing. You don't have to get caught up in what we mean by a definition. You're not expected to use data that's not useful to you. You can tell us whatever barriers or challenges you're having that are meaningful. You can tell your story of success using the data that's going to augment that story. And basically, we will have information then that we can just take and put into, we'll frame our report to Congress along these 8 questions. What happens then after this APPR is done? Oh, so let me step back a minute. Any of you, while I don't expect many of you have given a lot of thought to this year's APPR, some of you have been using the template already. Some of you have been collecting data using that template. Some of you found that template very helpful and actually helped you move forward within your state to collect information that previously you didn't have access to. We don't want to change any of that. So if your submission, if you've already been using the template, or if you found the template useful to use because it did ask the right questions for you, you can still use the template. You need to ask, you need to answer the narrative questions, but you can use the template to back up the information that you're providing and telling your story. So we don't want you to negate any work or time that you spent in trying to prepare for this year's APPR. If you spent time doing that, we encourage you, we ask you to use whatever you've collected to tell your story. Don't go in a different direction. If the tool's useful and you want to use it as part of your submission, it can be an addendum, whatever you want, go ahead. If the tool was not useful, you can use whatever tools you're using that you want to use to tell your story and support your questions. So that is kind of where we are. And basically what I want to do in a moment is I want to kind of share, I'm going to share with you the questions. We're going to post those in a moment. And then what I'm going to ask of you is for any feedback related to everything I just shared with you, any concerns you have, any questions you have. Here's what happens. This is not yet final because I still have to go back to OMB and get their approval. We were told we shouldn't anticipate a problem because basically the questions were taken from the framing of the tool in the first place. And we're still asking you to share data. We're just not asking you to use the tool we created. So we're not anticipating any problem, but basically you'll take these 8 questions, you'll create whatever narrative report, like you did with your initial grant final report. You'll basically take these 8 questions, you'll answer these 8 questions, you'll use data to answer those 8 questions, and that is your APPR for this year. If something happens and OMB by any chance doesn't approve the modification, we'll share the questions with you at the end of this week in a formal way. If something happens and OMB doesn't approve the change, then we will have to either trash the APPR for the second year or come up with a different option. But basically, we're not expecting that to be a problem. So, and then the other thing I guess I want to say to you now is when you complete your quarterly reports, you give us updates of the activities that you've done in that quarter. When you complete this APPR narrative, you're basically telling us, so what happened? What did you learn? What was the outcome of those activities? So it's not about cutting and pasting what you put in the quarterly reports or repeating what you put in the quarterly reports. It's about telling us, you told us what you did, now tell us what it meant. How did the funds get used? What difference did it make? What advancements have you made? What challenges do you still face, and are you working on correcting? Those kinds of things. So I'm going to stop for a moment. I'm going to ask, I think it was Stephanie who was going to share the questions so we can take a quick look at the questions. And then I'm going to stop and we're going to open it up for comments, which you can either type in the chat, or I will also give an opportunity for people to take themselves off, raise a hand, and we'll get you off of mute. You can take yourself off mute and speak once you've raised your hand. So here are the questions. To tell your story using data from your comprehensive needs assessment, your ESIDS, if applicable, your PPEP, and other data collected to articulate the progress made in your strategic plan, answer the following questions. And I think what I'm going to do is modify this sheet so that basically it's going to say at the beginning of every sentence, tell your story using, answer this question using data. How did you use the PDG grant? So you can have narrative and data, understood that data is part of your response. But broadly, how did you use the PDG Birth to 5 grant to support the development or enhancement of your statewide comprehensive early childhood care and education system? Right? That's what this whole grant is about. How have the PDG funds helped you use existing federal, state, local, and non-governmental resources more efficiently to strengthen the delivery of existing programs? Include efforts to align regulatory standards and requirements and efficiencies resulting from resource sharing, coordination of services, reduction in duplication of services. In addition, describe other approaches to improve resource efficiency. Third, how have PDG Bertha 5 funds helped to improve the coordination and delivery of services across models and funding streams in the state's mixed delivery system? In your response, please be sure to include Head Start and child care providers, home visiting and preschool programs, state, local governments, Indian tribes, tribal organizations, private entities, including faith and community-based entities, and local educational agencies. 4, how have PDG funds helped you develop recommendations to better use existing resources to serve more children and families and improve the overall participation of children in a mixed delivery system of federal, state, local early childhood care and education programs? Be sure your response includes specific mention of infants and toddlers, vulnerable, underserved, or unserved children, and children with or at risk for disabilities. 5, how have PDG funds helped improve program quality while maintaining access and availability of services, including your response, workforce initiatives, expansion or revisions of quality standards, program expansion, etc. 6, how have PDG funds helped to maximize family and parental choice and knowledge of and engagement with existing programs in the state's mixed delivery system, easing access to all services? Include specific mention of progress related to coordinated eligibility and enrollment. 7, how have PDG funds helped enhance school readiness for children from low income and disadvantaged families, effectively transitioning children into elementary school? And 8, how have PDG funds helped enhance or improve data coordination and sharing in your state's early care and education system, including your response progress related to ESIDS, state longitudinal data systems, and distinct counts? Those would be the 8 questions. They do 2 things. They pull information out of the PPEP. You can see here with multiple questions that kind of got blended in here. And then they take the core purposes of your activities and they kind of say, and here they're all represented here. So this allows us to frame, basically take your content, incorporate it into, summarize it or analyze it across these 8 questions, and it will become our report to Congress. At the same time, it allows you to use these questions and the data you need to support the answers to these questions to tell your story in any way you need to tell it. Later on, you're going to hear about the grantee work group that exists that you can join if you haven't already joined. You're going to also have APPR office hours every other week that the TA provider will be providing, and the federal project officers, one or another of us will join to answer questions if we can be helpful. And we'll, like we did last year, we'll give you time to kind of take this in and process this. These are, when we do a breakout group in a little bit, what we're going to do is you're going to, when you join a breakout group, you're going to tackle one or a combination of one or more of these questions. And you're just going to talk about what you see, what you think. Is this hard? Are these the right questions? You know, what does this move for you? So what I want to do now is I'm basically going to open it up. I'm going to start with what I think are 2 questions in the chat. I'll look at those, and then others, we're going to go to the, you can stop sharing your screen. Let's go to full gallery view. And then let's see if, let me see if I can go to full gallery view. And then let's see if we can, if people have questions or comments. I'd love to hear your thoughts and ideas. But first, let me look at the chat. The questions, sorry, that was for before. So are you saying 8 questions replace the full APPR, the collection of child data, counts, financial data? So yes and no, right? The 8 questions incorporate now any data that you collect that's going to support answers to those questions. But if you answer those 8 questions using the data that you have in your state that provides explanation of how those answers are correct, then you will have completed the entire APPR. If the new report isn't approved, we won't complete the APR, or would we just revert back to the initial APR we did last year? Just want to make sure I understand, because we're preparing to reach out to stakeholders to collect information. It is not my, if the new one is not approved, we will probably move to the modified version, which will be less questions, less data that we ask, but we still have to get that. So what I would say to you is, if you were planning to reach out to your stakeholders, if you could hold off another week or so, we should be able to have an answer within the next 2 weeks, whether this is going to fly or not. So let me see what we have here. So Laverne, Head, you have your hand raised. We'll call on you first. Comments, questions, concerns, annoyance, frustration, anger, whatever you have.
No frustration. I think this is actually great for the state of Illinois. But I do have questions because we did complete year 1 APPR. And so in that template that we completed, there was a character limit, right? We were only allowed to put so many words in certain sections of that report. Is that going to be the same for the narrative template?
No, because basically all we're going to give you are the questions on a sheet of paper. When we say a template, all it's going to be is, here are the questions, you put it in a narrative document, and now what we are going to do, we haven't done this yet, what we are going to do by the end of the week when we send you the formal questions is we will send you, so what I want to do is I want to hear the discussion today, possibly tweak any of the questions if we need to, and then we're going to send them to you. What we're going to send to you along those questions are the minimum and maximum number of words. Not that it's not letters, but look, we're not looking for books. So we don't want to know everything. We don't want a 150-page report from you. What we want you to do is to be succinct and answer the question. So if you can tell us, you can do it in as little few words as you can, or as little data as you can, but basically we want to understand the answer to your question. If you can do that in a page or two, great. If it takes 5 pages, okay, but we're not looking for 25-page answers to questions. We don't want to say you can't go more than 2 pages, because if it takes you 3 pages, then we want you to be able to tell your story. But we also don't want you to go on endlessly. More isn't better. Okay, does that help?
Yes, and so to receive additional clarification to Gary's question from North Carolina, the collection of child data accounts and financial data. I know that you stated that we would include that in the narrative template, right? But depending on how many programs that we list in our mixed delivery system, that's dependent on how much of the child data accounts we're going to collect, and also the financial data.
Okay, so let's separate 2 things here.
Okay.
I want to go back again to the purpose of this report for the state and the purpose of this report for us. You should be, or whether we gave you an APPR or not, you should be collecting data that's going to inform the decisions you need to make in your state to improve your programs and services. You can collect whatever data you want. You can continue to collect the data in the Excel spreadsheet. Hopefully, I suspect many of you are collecting data that goes way beyond what's in the Excel spreadsheet. You should still do that. And what you do with that data is up to you. We don't need you to give us answers. So the Excel spreadsheet, you may not refer to it at all anymore. You may just look at the questions in these 8 questions and say, and this is part of what the breakout group is going to help you do in a few minutes. But you may look at the questions and say, okay, this question asks us to do this. What data do I have that's going to support the answer to this question? And all you're going to do is provide whatever data supports the answer to that question. And some of the questions tell you, we want to hear about Head Start and childcare and home visiting, and some are not specific at all. So you will have the ability to modify the way you answer that, what data you include. You determine the data you have that answers the question we asked. So one of the criticisms we received by a number of states, one of the recommendations we received by a number of states is, it really would have been helpful, or the questions you asked us were not helpful in us telling you the story in the best way we could tell you, because the data we are collecting is not the data you asked for, or the data we are collecting that answers this question was different than the data you asked for. It would be better. So what we're trying to do, in the same way we did it with the application, is give you the flexibility to tell us what data are you collecting that answers these questions? And so forget about the financial data or the actual questions that were in the APR, the APPR the first year. If you don't answer any of them, you don't answer the way they're worded, you don't answer any of them. We want you to answer what makes sense in terms of the 8 questions posed. Okay. For some reason, and I don't know why, I'm going to go back up and look. For some reason, I'm not able to advance and see everybody on the screen. It says I have 77 participants, but for whatever reason, I no longer have the arrows that allow me to go left or right. So I don't know if other people, maybe TA providers, can you see hands raised, or people take yourself off mute and just speak up if you have comments or questions?
And you do also have 3 new questions in the chat.
Oh, okay. I missed them altogether. Thank you. Let's see. So about how many pages for the full report? Don't know yet, but I'll give you a sense. I would say off the top of my head right now, if there's 8 questions, I don't know, 50 pages, 40 pages, 30 pages. I don't know. I think I would say probably no more than 50 and probably no less than 20. I mean, again, we want you to answer the question. So if you can answer the question in a way, we're not looking for length, we're looking for clarity. Okay, could we possibly answer the narrative questions and refer to an appendix that has the data? Absolutely. You can refer to data in any way that it's helpful. That's why if you wanted to still use the Excel spreadsheet, you could refer to the Excel spreadsheet. If you had a different data source, you can refer to the appendix A and B. Appendix A answers core. We often include those graphics. Absolutely. This is your story. Whatever's going to allow you to tell the story is the way you should tell it. So if the graphics tell the story better than the words, use the graphics. We're not looking to limit you in the way you tell your story. Okay, thank you for work on this. I'm breathing a sigh of relief. Looking at this at first glance, they're thoughtful, applicable, and also will be useful sharing the impact PDG with our stakeholders. Thank you, Amanda. I love this. Wheels are already turning on how I approach these. Thank you, Lindsay. 1+1 to Amanda. Washington State is feeling good about the new format. It should help us articulate the systems level development occurring across a complex mixed delivery system. Okay, excellent. Thanks. And as you thank me, know that you're thanking the TA network, you're thanking all the FPOs, you're thanking all of us who've worked really hard to try to figure this out and be responsive to your suggestions. At the end of the day, this APPR has to be helpful to you. If it's just helpful to us, we failed. If it's just helpful to you, we also failed because we still have to tell a story to Congress. We still have to understand the data, talk to our leadership about it. So hopefully this is all going to help all of us. Wyoming's also breathing a sigh of relief. Thanks to the work group members who worked through this. Okay, excellent. Wendy, you have your hand raised. Wendy Baker, go ahead.
I do. And, I'm just sharing my thoughts here without having had a whole lot of time to think about it. But first, let me say thank you. I think this really is a much better approach, certainly for Nebraska and the way that we conceptualized systems change to start with.
Okay.
But recognizing it is, for us, it is very much a mixed delivery system. Mm-hmm. And so one of the challenges we had in the APPR was, we might have presented the information at the state level, but what is happening in our implementation is across the mixed delivery system.
Yes.
So it is much more likely in the responses that you will see far more qualitative information. And the data that's presented is going to be specific to the delivery, where it is in the delivery system. So let me give you an example. Our subgrants program is a program called Communities for Kids. And Nebraska being a very rural state, there are collaboratives across cities and regions that pull in providers. And, we're seeing really great things happen as a product of that. And even through the pandemic, we've seen some resilience in that strategy. But the information that we present from them is going to be specifically about them. So trying to aggregate information standardized in that way, I think is more challenging. And that's something we faced with the APPR, and honestly felt like we weren't telling our story because it wasn't as directly connected to the interventions or the projects that we have. So I applaud. I just, I think that's where our challenge lies. And we'll do our best to look at those segments that are compatible in terms of aggregating data, and know that, the connections to the state system level are not kind of probably going to be as direct. Does
You
that
know
make
what?
sense?
It does make sense. And I think I'm glad you raised it, because it very well may be that when you tell your story, you don't try to aggregate the data, that you tell your story by community, that you say, because of the way Nebraska is, we have this communities for kids, and here is how it looks different across the state. We're not yet at the place to be able to aggregate this data, but this helps tell the story of Nebraska. This helps give you a picture of the services being delivered, the progress being made, the challenges being faced, etc. So aggregation of data is a challenge for you, just like it is for us. We saw how difficult it was. We can't imagine it has to be difficult for you too. So maybe aggregation of data is not what you're able to do yet. And yet in another state, you may have solved the aggregation of data problem, or you may have solved it across certain programs, and you'll be in a different place to be able to report it. So what we're doing now is we're allowing each of you to tell your story based on the realities you face in your state and the data you've been able to collect, or that has proved most meaningful for you to speak about the difference that PDG Birth to 5 has made in the progress that you're making in your state. Here are a couple more comments. Let's see. So when answering, I think we've already answered this, but when answering the 8 questions, you're utilizing a Word format. You're not using Excel at all. You're not expected to touch Excel unless you choose to. I want to hear more about what was talked about, the data that might be collected when the American Families Plan rolls out, whatever that means. So I don't know what it means either, right? Part of the reason I couldn't answer the question, I think what's happening is, so you would not be surprised because you do this in your state, right? What's happening now is this thing is pending. We're all in a panic, just like you are, trying to figure out, oh crap, what do we do now? What is this program going to look like? What are we going to roll out? How much time are we going to have? What's the legislation going to say? And so we're working in teams trying to figure out what this will look like. We can't really talk about that yet with you guys because it's just talk right now. But the question asked was, well, do you know what data questions you're going to ask? Well, honestly, I don't. I haven't even thought about the data questions yet. And part of me was waiting to see what the legislation says to determine how to work backwards. What's the expectation here? What's being said or what's being talked about, though, is, and this part does make sense to me, if we're trying to create less problems for you with every program we give you funding for, then we want to try to be better aligned in the data we request, in the needs assessments we ask you to do, in whatever we're going to ask across multiple funding streams, and see if we can better coordinate those requests so we're asking for things that make sense, that build off of each other. So the data we ask for UPK, I think I might have told some of you this already before, but one of the questions we were asked is why do we need PDG Birth to 5 if we're going to have universal pre-K? And the answer, first of all, showed that people didn't understand what PDG Birth to 5 was, right? But UPK, universal pre-K, is about individual service delivery. It's about delivery to children. PDG Birth to 5 is about systems development and collaboration and improvement. The work you're doing should place you in a much stronger position to implement UPK, whatever that ends up looking like. It should at least be able, you should be working on those structures that are going to enable you to implement a program that makes the most sense. And so it also makes sense then, although I wasn't crazy about the question, it also makes sense then to say, okay, yeah, maybe it does make sense to try to figure out what those data questions are going to be and see if we can align them. So it is what's going to happen at the end of this is we're going to take the APPR, the new APPR that you submit to us, these response to these 8 questions. We're going to take this and we're going to analyze it. We're going to do what we did last time. We're going to have your work groups come together and look at it. We're going to, FPOs and TA providers are going to look at it, try to sort it out. We're going to create the report to Congress, which is great. This year's report to Congress has to do with your final report from the initial year. Next year's will have to do with this. And what we do then is we do another assessment. By then, in theory, we have a past American Families Plan, a UPK program that's being implemented in some way, shape, or form, or being initiated. And then we can begin to look at, okay, is there a need to now change the third year's APPR in a slightly different way so that we're now collecting data that supports the data that we're going to ask you to collect in a UPK or a new child care program. And we can try to align that so that we're not asking you for conflicting information, but we're asking you for information that builds on or supports or enhances what you're going to be asked to do in the next program. So that's the goal. That's the vision. How easy? I don't know. It does keep me up at night, but for now, I think it sounds like it will work. Let's see. New Jersey appreciates the new format, approach in reporting. This makes so much sense. Working with our partners who are tracking our performance evaluation data, keep saying that if the grant were longer, we could do a better job measuring outcomes. How much of the data will be qualitative in nature? But much of the data will be qualitative in nature. Yep, understood. As a state drafting its first APPR, we understand that this format provides an opportunity to report on Puerto Rico's early childhood efforts. Excellent. Lorna from Connecticut has her hands up. Sorry, Lorna, I didn't see your hand, so please go ahead.
That's all right. I echo all of the thank yous that have been sent in the chat, and I actually exponentially echo the thank yous. And I thank you very much. So thank our TA specialist Faith, and certainly our FPO Judy. Thank you, and everyone. But the reason why I wanted to come off camera and to speak, and I hope my colleagues here would agree, and if not, I apologize in advance. The reason why it's so appreciative you taking this approach is it validates the purpose of when we're working with the families in the community and providers, working with them in a more personalized manner and recognizing the strengths and the areas of growth that pertain to those families and the providers. And that's what we talk about in terms of taking an equitable approach with engagement. And so this measure greatly appreciate how it's articulating the difference between equality and equity. And very much, again, just thank you so much for the pivot that has taken place with the APPR. And if I may say, pre-COVID times, I'd want to give you all a handshake. But now I'll just leave my hand up in the air and say thank you once again.
Thank you. Very much appreciate it. And thank you, Lorna. Okay, let's see. So again, for whatever reason, I can't advance my screen to see who has a hand raised. So if anyone else wants to come off mute and speak, or type in the chat, you can. If I don't get a question in 30 seconds, I am going to switch over to Stephanie Guerres and Mandy and the TA team, and they're going to talk about this breakout session we want to have. What I will say to you as I'm waiting for a question is that I will come back on at the end. So talk about next steps. So we can have those next steps, try to answer those final questions for you and give you some timing of what you can expect, when you can expect it. So any more questions, or comments, statements, advice? When you go into your breakout groups, please take a look at these questions. If you think they're not asking something in the right way, this is the time to speak up. If you think, hey, it would be better if we went this approach or that approach, or you're missing a whole piece here. I don't care if we end up with 10 questions or 7 questions, or someone says, let's combine these two. whatever. This is our last chance to tweak this before we go forward to OMB. I wanted to make sure you had a chance to look at them initially, and then we'll go forward and we'll take it from there. Okay, I'm going to ask this 3 times. This is what I usually do in my presentations. I will ask a question. So does anyone have anything else to say? Does anyone have anything else to say? Does anyone else have anything else to say? Okay, with that, I pass it on to whomever's taking it from here. I think it's Stephanie.
Hey, everyone. So I just put the breakout questions in the chat, and I don't know why, but it's a very ugly format. But your specialist will have that in the room. And what I want to do, the breakout rooms are going to be self-select. So I want to go ahead and put the questions back up. But you can, the breakout rooms, they do center around 1 question or 2 questions. You know, we're first going to say, what do you like about the format? What clarifications are needed, or what other supports would be helpful? And then we want you all to kind of talk about what information you may need to complete the question. And as Richard said, of course, what do you want to tweak? What do you want to tweak about the question? And then when we come back in 15 minutes, the TA specialist that's facilitating your room will share out probably just one item from the breakout discussion. So
there may be FPOs in your group. They're just there to listen and help sort out what we need to do next. So hopefully no one will mind their inclusion. We're all trying to sort this out together. And Stephanie, how many breakouts are we going to have?
we have 5.
Okay, so we have 8 questions. Do you know which questions are not going to be looked at, or are they all going to be looked at in one way or another?
So one breakout room is going to be talking about questions 2 and 3, and we kind of titled that coordination.
Okay.
Breakout room 2 is question 4, which is services. Breakout room 3 is question 5, which is program quality. And then breakout 4 is questions 6 and 7, which we've kind of titled family engagement. And then breakout room 5 is going to look at question 1 and 8. We've titled that data and systems.
Okay. So people are going to self-select. Is that what you said?
Yes.
Okay.
So you should see the selection. Is that correct, Carla?
Yes, I opened the rooms, so everyone should have the option to choose the one that they would like to join.
So basically, if I want to join, I just hit A, B, C, D, or E, and I end up joining.
Correct.
Okay, cool. Everybody have fun. See you in a little while.
Looks like everybody's making it back. Lively discussion in my room. I hope everybody probably experienced the same. We're going to spend, Richard, maybe just about 5 minutes getting a little bit of feedback and sharing out the conversations from each of the various breakout rooms. And then I'll talk a little bit about some things that are coming up next. And then we'll turn it back over to Richard for some closing remarks. So we'll have the TA specialist give the report out. So I'll tell you what, I'll just ask people as I see them on my screen. So Mandy, do you want to start and tell us about the feedback that you got in your group?
Sure. We talked about new question 5, which correlates to section C from the old APPR. Everyone was excited. I had 2 states who've never done an APPR yet, so it was great to have the contrast. And since this question is really specifically sort of about programs and program quality and services, we discussed how to reflect COVID and the impact that COVID is having on the data that they were brainstorming, sharing. And so it's just a nice way to think about making sure that you include the impact of COVID in your narrative, and a good opportunity to talk about the context.
Thanks, Mandy. Howard, which questions did you have and what were a couple of key points?
Sure. So we started one of the questions 1 and 8, but we started with about the format. And one of the couple of the common things that we're hearing is really liking the fact that this new format is something that they're able to share with a broad range of stakeholders, and really see the usefulness in that in regards to communicating the work that's being done through PDG B5. In regards to also kind of thinking through the capacity that states have right now to accomplish the tremendous amount of work that's happening. And so this streamlined approach really seems like there was a thoughtful intent on really thinking about states' capacity to complete this work compared to the previous iteration of it. And then thinking about the last question in regards to helping improve or enhance data coordination in ECIDS, really thinking about the process that they're using to accomplish the work and providing an example of how they were able to make progress on that goal.
Great, thanks, Howard. Faith.
Hey, everyone. Mostly what we talked about was just the excitement of this format being so much easier. But we also talked about some of the clarifications was kind of comparing state definitions and federal definitions. And so the examples that we looked at was for the question number 7, where it talks about school readiness. And then Richard popped in and helped us to get some clarification. But one of the other suggestions of necessary documents to complete this was a suggestion for the first year planning grant report to pull information from and then kind of build off of that. So that's kind of where our conversation centered around.
Okay, good deal. Stephanie.
Okay, so, basically everyone, echoing, they really like the format. When we talked about the question, we talked about question number 4, which was on services. Talked about returning, kind of looking back at the initiatives and looking at the data they're collecting, and kind of seeing, are there trends, what kind of data they can pull, looking at the strategic plan and the performance evaluation. And another idea, maybe a new question or maybe guidance about adding it to one of the questions is, as they've gone through these last 2 years, they may have seen other initiatives that are needed and that may need to be funded. So a place to kind of write something to how you can move forward, what else is needed in the state.
All right. And my group had the first, actually question number 2 and 3 that was focused on coordination. You all remember that was a big lift on the Excel file. And so we got a lot of really great feedback related to, this is going to allow us to much better be able to tell our story, especially around those systems efforts that they're making. There was a couple, there was kind of one, I think really key comment of, it's hard to make big systems impact in the short amount of time that we've had PDG. And I thought Tammy had a really good comment about don't underestimate your collaboration work. And so thinking about how to make sure to put that into the work. But basically, we predominantly just got through the first couple of questions, but I think, again, also thinking about how to have some of those similar definitions would be helpful to states, as we talked about earlier. All right. Any other comments from anybody before I talk about next steps?
Deborah, it looks like Howard put a question in the chat from his group.
Oh, thank you.
For Richard to address.
Howard,
yeah, he just asked
Yeah,
where the group, I guess, where would you see program fiscal information fitting in?
Yeah, and that was just around a clarification that they would like to see.
Okay. So we'll make note of that then. All right, getting a few other clarifications. So if you didn't have a chance to share those out in your group, if you want to put some of those in the chat, that will be very helpful. We'll take a look at those later. All right, very briefly, the APPR work group got a little off schedule this month because of the annual convening that's happening next week, but this week on Thursday at, let me get my time zones, 3 p.m. Eastern, noon Pacific time will be the next APPR work group. We're going to process some more on Thursday, the things that we talked about today. So if you're a member of that work group, we look forward to seeing you. If you'd like to join, you can email either Stephanie or myself, and we'll get you on the list and make sure you see the invite for that. And then speaking of the annual convening, on Thursday of the annual convening, there is a session that's titled Alignment of APPR, PPEP, all of our acronyms, and strategic plan. And so that session is really going to focus on how these things all fit together. We're really lead you through some thinking about systems and how each of those pieces are so integrally connected. And I think that'll be an exciting session to kind of wrap everything up and tie it together. So with that, Richard, I'm ready to turn it back over to you. Thank you, everybody.
Thanks, Deborah. And also, I think what you will also see is there are APPR office hour meetings, I think, that are scheduled as well, that are coming up every other week. So as you're progressing, as you're moving along, if you have questions, if you're challenged, what should I be doing? Does this make sense? You can join those office hour meetings. I think, Stephanie, if someone is not already signed up for office hours, what do they need to do to get signed up? Or how do they find out about it if they're new to this?
So the office hours are in the grantee newsletter. So the link is in there, but we'll make sure.
Let's send it out again after this then,
yeah,
so people know about it.
I was going to say
good.
The specialist can help with the dates.
Okay, good. That's great. So a couple of next steps and then a chance for any last comments or questions that you have. So tomorrow I'm going to be meeting with SRI and with some of the FPOs. We're going to be talking about any feedback that you shared here, including questions that you posed, suggestions that you had, to see if we're going to make any changes to any of the questions as they presently exist. I didn't hear any feedback that suggests we should have more questions. So I'm going to assume that there are no more questions being added. But I also didn't hear any feedback that said we should have less questions. So I'm assuming we're at the right number. And we'll just see if we need to tweak anything. My intent then is to send notification to our contact to set up a discussion with OMB to get approval on this new process or answer any questions that they have. And I'll do that on Thursday if everything works out well tomorrow. And at the same time, we will send you on Thursday the list of questions in case there's been any tweaking. We'll send you that list as it exists now. So you can start working on it if you want, or thinking about it. And even if we never get to ask those questions or you have them for yourselves and you can use them now as the questions that guide your informing of your stakeholders and progress you're making in your state. I heard a great suggestion that I feel bad that I didn't think of it. So thank you, whoever thought of it. This idea of going back and looking at your initial grant final report as a jumping off point. Now, maybe you do that already, but from our perspective, if you start from there as well, and you look at what you said in your final report and say, where have you come since then? There's a nice way to do a transition from that first year or two of work to say, here's where we are, here's what we started, here's where we're moving, and here's where we see ourselves going. So I think that's just a nice, it may or may not be useful to all of you, but I think it's a nice place to take a look at what you've done. So thank you for that suggestion. I'm going to wait until I get an answer from OMB before I answer the questions about minimum and maximum length, because they may have something that they want to say about that. But again, I would repeat what I said before. Answers should be as short as they can be, but answer the question. So I'm not looking for more pages. The more is not better. And I would ask you to think about, if you were sharing this with your leadership, your governor's office, whoever, your state legislature, does this answer the question sufficiently? If you think it does, then it's probably sufficient for us as well. So when is this going to be due? Well, one of the things I'm struggling with is the reality. I'm still struggling with the reality of the very likely the very likelihood of the American Families Plan passing in some shape or form, and what that's going to mean for your workload. So part of me wants to give you more time and say, well, you should have more time. And part of me is afraid to give you more time, because if that hits and all of a sudden you've got to, and in a lot of cases, you'll be the same one writing the application or whatever needs to be submitted. You'll be the same one doing that as pulling together this report. So what I'd like to do is kind of say, you can submit this report as early as December. You can submit this report as late as March 31st. So if it's easier for you to get it done sooner and you want to work on it and just get it done and give it to us at the end of the month, at the end of December, at the end of this year, go right ahead. If you want to take more time, take more time. I hate saying this because it opens the door, but I mean, obviously, if you need a little more time than March 31st, we'll grant it to you. But I really do want you and us to be aware of all that's coming down the pike and how much you can juggle at the same time. So hopefully you can keep that in mind as you're making plans on how best to respond to this. So the window of response will be anytime from the end of December or the end of December to the end of March. And hopefully, and you can discuss that with your federal project officers and with your TA specialists to determine any ways that they might be able to advise or support what you'd like to use as a decision. It'll be important for them to know when you're targeting to submit, because that helps us plan and also know how to build in time for review and, or extra time that we may need as well. So those are my comments about next steps. I'd like now open it up to any questions you have, either in the chat, or you can take yourself off mute, or you can raise your hand. I now have ability to see everybody again, so that's good. Was something I did, of course, with the technology, but I'm terrible with technology. Anyhow, if you have any other questions that we haven't answered, something else you want to say, this is the time to share it. You can take yourself off mute or raise your hands or go in the chat. Just checking. I see nothing else in the chat. Okay. Are there any other comments or questions? Are there any other comments or questions?
Sorry, Richard, just one quick question. We will submit this to you all via email and Grant Solutions.
Great question. How did we do the APPRs?
We sent a copy to like our project officer and you as well.
Yeah, we didn't use Grant Solutions though, did we?
No.
Yeah, okay, so we don't need to use Grant Solutions for this then either, I don't think. Well, that's a great question. I'll talk to the team. We'll get back to you, but I think we'll probably use the same process that we used for the original submit, the first time we submitted.
Okay, thank you.
Oh, great question. Are there any other comments or questions? Are there any other comments or questions? Are there any other comments or questions? Okay, well, thank you all for joining today. I hope it sounds like this was helpful, and it sounds like you all received it as the gift that we hoped it would be, and not as the frustration or shock that it could have been. So thank you. We look forward to working with you on this. Thank you to the TA team for helping make this. Thank you for the FPO team. Tammy and I are very pleased with everything that you're all doing. And for all the feedback that you've given us as well. It's great to hear that this is going to allow you to tell the story that you need to tell. Continue to raise questions as they come up, and we'll do our best to be responsive as we have been trying to be. So thank you all. Good luck, and talk to you soon. Take care and have a great rest of your week. Oh, see you at the annual convening.